thought-provoking abstract presentations, it is my pleasure to introduce Dr. Gamez and Ms. Becca Fealk, whose expertise in health policy and advocacy will complement and expand upon our discussion by presenting on the topic towards people-centered policy and practice. Dr. Gamez is a mother, partner, embodied leader, mobilizer, researcher, storyteller, and freedom dreamer. She holds a PhD in Justice Studies from Arizona State University and most recently served as the Assistant Director of Advocacy at Boston University's Center for Anti-Racist Research. Becca Fealk has worked in both direct client services and policy-based areas related to reforming and dismantling the carceral system, including time with the Yavapai Reentry Project, Arizona Children Association's Children of Incarcerated Parents Program, Just Communities Arizona, formerly the American Friends Service Committee of Arizona, and Read Between the Bars. Through collaborative research and policy advocacy, she has worked to provide community education, state legislative reform, and narrative shift to promote healing over harm in Arizona. Let's now hear from Dr. Grace Gamez and Ms. Fealk.
Hello, everyone. Good afternoon. My name is Becca Fealk, and I'm here with Dr. Grace Gamez today to speak on the topic of policy and narrative change that is imperative to making shifts in our society. This discussion will focus on a few topic areas, but its application is universal as it is grounded in building trust and committed relationships for policy reform. Because when we look into any sort of policy change, from something as simple as determining a state drink, which for those who may not know, Arizona, it is lemonade, and that bill almost did not pass. It is also important for impactful areas such as funding for education, but all of this is driven by people and their experiences. If our goal is to have a functional, sustainable, and impactful policy shift, that is only possible when it is centered by, for, and to serve the people who are directly impacted. When that is not part of the original understanding, design, and goal of the policy change, that is when we witness issues in areas such as the inability to implement a program, failure to obtain continued funding, or inconclusive results in our research. So we will be going over all of that today with you. We will provide an overview of how you can move towards people-centered policy and practice today by sharing a framework developed by Dr. Gamez and her team while she was at the Center for Anti-Racist Research at Boston University, while we are sharing examples of our previous policy work here in Arizona and providing materials for extended review and learning. These are the objectives for our time together today. We want to understand the importance of community-centered design and research, policy, and programming. We want to locate work along the community power building spectrum, and we want to recognize the process of how to take the action alongside people who are most affected towards policy and legislative change. Though we are anchoring today's conversation in Dr. Gamez's and I's previous work in the criminal legal policy system, though we're anchoring it today in the criminal legal policy work, the ethics of community engagement translate across fields of study and practice. During our time together, we invite you to consider how what we're discussing today might apply to the work you are doing or what you are looking to move towards in the future. So we want you to consider what resonates for you as we speak. Consider taking notes or jotting down lines that strike an idea or an emotion for you. Consider why it resonates. Is it related to a personal experience or a lesson you've learned in the past? Think about what next aligned steps you could take. Consider where you are at the moment in your work or your personal life. The step is based on with the knowledge that you gained today. For most, that'll include internal reflection and reconnecting with your relationships versus immediately jumping into some sort of policy campaign. We want you to think about how you might engage with community partners in your work domain. Consider where you have current relationships and where you might not. Where can you build relationships? And how do you know when it is appropriate to maybe take a step back in your work? What would it mean to shift internally in your organization or practice? And how can you advocate for change in your field to be successful in a larger policy? When we talk about policy work, it is imperative to know that internal organization work often needs to happen before taking an outward-facing policy approach. Our discussion will apply to both the macro level of changes, but also micro level. Consider the internal policies of your practice or your office and how they might be in reinforcing bias and preventing trust from people who are most impacted that you need to gain trust with to make internal and external change. It is important to think deeply on these issues and question methods or processes you may have always done or used in the past. In what ways might those methods have been biased or harmful?
Thank you so much, Becca. Good afternoon, everyone. My name is Grace, and I'm so grateful to be here with all of you and nerd out on this issue that's dear to my heart, which is the centrality of community voice in producing meaningful, sustainable, and collective power building or anti-racist outcomes. First, I'd like to start with some of the kind of common pitfalls that institutions, nonprofits, and policy actors face when striving to build equal relationships with community members. The history and pedagogy of policy and program design, especially in academia in the United States, has been deeply rooted in Western Eurocentric values and colonialism, in which race and class agnostic design methodologies compelled researchers and scholars to systematically design around the historical, political, and structural causes of inequalities communities face. However, because of quick funding timelines and expectations, our work often fails to account for and contextualize the way in which institutions, systems, culture, and history, in particular systemic racism and injustice, show up in the methodologies and even the design of our work. And as a result, the solutions that are generated are often ahistorical, apolitical, and fail to have the desired effect. Oftentimes, academic institutions and nonprofit organizations prioritize their expertise over the lived experience of people, and in doing so, perpetuate existing power structures, largely excluding Black, Indigenous, and people of color from the research, program, and policy design process. This notion that any person can design for anyone else, particularly people with different race and gender identities, has meant that diversity, inclusivity, and lived experience have been viewed as disposable, non-essential features when designing research policy and programs. Oftentimes, academia actively marginalizes many resource-denied communities by eliminating their voices unless those voices are collected and mediated through the lens of those in positions of power who know little of their experience. While we may hear another person's words or see their actions, our interpretation of those events is based on who we are, not who they are. Lastly, the default of community engagement is often one-time surveys, focus groups, and listening tours, which often extract and tokenize community voice because community members are one-time nodal points in the long timeline of policy and program design, and are frequently left out from decision-making and evaluation processes from start to end. So what we need to ask ourselves is, are we thinking of community members as consultants, collaborators, partners, or leaders? So in an effort to contextualize the concentration versus redistribution of power in designing anti-racist policies and systems, and to provide a framework for understanding how design efforts can undermine or uphold equity, my colleagues and I at Boston University Center for Anti-Racist Research developed the Community Power Building Continuum, which maps the locus of power in relation to a range of human-centered design and community participatory methodologies. Specifically, before beginning any program or policy design effort, practitioners and policymakers should consider: 1, who has the power to influence and direct the design process and its outcomes? And 2, whose context, defined through stories, experiences, and expertise, are centered in the design process and in which ways. And as we move to the right of this continuum, the nexus of power shifts from those with formal authority or design towards those with lived experience. So at the far left of this continuum, exclusion and tokenism render community members passive recipients of design efforts amidst an ecosystem in which the major strategy or programmatic decisions have already been made by designers and others in positions of formal power and authority. There is a unidirectional flow of educating and sometimes placating from those in power to community members. In systems and institutions such as the criminal legal or punishment system and the family policing system, the intention is to design policies and programs that center people most impacted. But these practices of exclusion and tokenism often manifest as manipulation or decoration, in which historically excluded people are made to play out these predetermined performative roles in the decision-making agendas of people who have formal power, where they're provided little context of the implication or goals of the initiative that they're involved in, or not given any feedback with how their ideas are going to be used. Consultation, commonly known as community engagement, is characterized by engaging those with lived experience as consultants in the nascent phase of defining a problem. This is the most popular form of interaction with community and academia, as they're most often sought out as participants through one-time listening tours, surveys, focus groups, and informational interviews. Community voice may be prioritized in the front end of a process to influence some decisions, but it's not institutionalized in a way that shifts power for the long term to enact structural change in policies and public systems. Ultimate decision-making and the nexus of power still lie in the hands of policymakers, service providers, or subject matter experts, and people with formal authority. They may or may not be compensated for their time. Furthermore, systems impacted community members are often not provided transparent updates on the findings when they are research subjects or the outcomes of policy or programs that were the result of their time and expertise. So as we move past consultation, further along the power continuum, community members become increasingly involved in the design work itself, contributing to the development of solutions. In co-design, designers, researchers, or practitioners, and community workers collaborate side by side at each step of the design process, often forming a joint design team. In order to effectively balance power between those with formal authority, the designers, and those without, community members, the team works together to determine who's involved, how, the content, methodology, and the location and schedule for the work. Co-design has a fixed timeline based on grant cycles and is still facilitated by external designers. So it can't fully attend to the healing and power shifting within historically excluded communities. That actually takes decades of commitment. Systems impacted people still operate under a research question or hypothesis that's frequently dictated by an external funder, designer, or organization. In community-driven design, those who hold power form an equitable as opposed to equal partnership with individuals and communities with lived experience. Community-driven design differs from co-design in that community members are involved from the very start, and efforts are made throughout the entire collaboration for those who traditionally hold power to intentionally use their authority to create collaboration and spaces in which community members have greater power. Specifically, it insists upon community members playing a legitimate decision-making role in each phase of the project, from defining the research questions to planning, design, and evaluation. This means they're involved in the process of understanding and framing the challenges facing their community and deciding which problems merit attention. Community members have the power to define the work and how it will take place, what the role of the designers and others with formal authority will be. And their job, really, those with formal authority, is to facilitate the process and ensure that community members who comprise the design team have the platform skills and material resources to design and develop solutions. So there are a number of specific methodologies that fall into the community-driven design category, including community participatory research, which democratizes knowledge production, liberatory design, which centralizes equity and self-awareness about identity, equity-centered community design, which is a nonlinear adaptive problem-solving framework. And as an example, in 2013, the city of Boston launched Youth Lead the Change. This was the first youth-led participatory budgeting initiative in the United States. Participatory budgeting is a democratic process in which community residents have power over how public money is spent at the local and national levels. It was lauded as a revolutionary civics in action. Participatory budgeting decentralizes formal power, holds government and public institutions accountable, and creates an environment for a more equitable allocation of public resources. The Boston Mayor's Office now works with 2,000 youth annually, ages 12 to 25, to determine how to spend $1 million of the city's capital budget per fiscal year, and youth identify and co-design projects through the Mayor's Youth Council. Community ownership most often takes the form of community organizing and falls within the rightmost category in the framework and prioritizes self-determination, policy advocacy, and activism, with policy change as the terminal goal. Community members are not seen as objects of design solutions, but as active change agents. Organizers seek to dismantle and reimagine existing systems in which transformation rather than reform is the desired outcome. Community organizing is rooted in a range of critical pedagogical frameworks. As an example, a community coalition, or COCO, a community organizing coalition in South LA, founded by a group of South LA activists of color in 1990, launched the Kinship in Action initiative, which organizes relative caregivers to advocate for the needs and rights, and has led to $36 million in funding adjudicated by the California legislature. And COCO's community organizing model for relative caregivers is rooted in community leadership development, policy advocacy training, mobilizing young voters of color in South LA, and civic engagement. Their campaign development model encompasses issue development, defining the problem in its historical, political, and economic context, a power analysis, and organizing strategy. And now Becca is going to share an example of how we activated this ethos in our work together at AFSC, organizing alongside people who are impacted by Arizona's punishment system. Broadly, our goal at American Friends Service Committee, or AFSC, was to center and follow community voice in our advocacy work, which included leadership development, narrative change work, co-designing community research, and community-led research and policy work. Our design practice represented an organizational shift, which Becca alluded to a little bit at the top of this presentation. That prior to actually engaging this work, internal work within the organization had to happen. Prior to joining AFSC, the work was not led or informed by people most impacted. And it was a long and draining process to move the executive director towards anti-racist design.
So as Dr. Gamez mentioned, in 2018, we actually worked on a bill trying to focus on doing a policy shift with a collaborative effort that put directly impacted people front and center for real change. A brief overview: this was a bill introduced by Representative Athena Selman, and it was to increase the availability of menstrual products for women in Arizona state prisons. The policy at the time, which was an internal policy with the Department of Corrections, was that if a woman could not purchase her own period products with her own money, they were limited to 12 pads a month, and these were very low quality menstrual products. The Representative Selman had learned about this issue in Colorado and reached out to our organization, AFFC, to help moving the bill. So we started to look into it and immediately connected with our Reframing Justice partners. Dr. Gamez talked about her project a little bit. Reframing Justice was a program she started to build and support the leadership of people who had been directly impacted by the carceral system. And she had deep ongoing relationships that had started long before this bill was even a thought. That allowed us to work with people without being extractive. From the conversations we had with people who were in prison and had experienced what it was like to manage a menstrual cycle with the resources or lack thereof in prison, we learned that tampons were extremely expensive from the commissary, a higher cost than what most people were able to afford if they were working. It took about 8 hours of work to be able to buy 20 tampons from the commissary. They reported discomfort and restrictions due to being able to obtain more period products, and often had problems if they were diagnosed with something such as endometriosis, which caused a heavy flow. And if they tried to support each other and share the products, or had some sort of bleeding through that stained their prison uniform, they could actually be given disciplinary action. So they told us this was a useful bill and something they could have an immediate impact on the physical, mental health, and well-being of people experiencing periods in prison. Therefore, we moved forward to help them with, to help moving this, and supported messaging, drafting talking points, and building stories around this to be able to move towards policy change. But one of the challenges we had with any sort of policy aspect was that chairs of each committee in the Arizona legislature have to agree to hear a bill. And it would have made the most sense for the health committee or even the judicial committee to hear the bill, but both chairs of these committees refused. This can be due to many reasons. Sometimes it's time constraints, sometimes it's a preferred interest area, a lack of knowledge on the topic. So we had to work with our other ongoing relationships with legislators to get someone to hear it. And we were able to get the Military and Veterans Affairs Committee to hear this bill. The committee was made up of 9 men, though. Nobody who had ever experienced a period. We had to, one of our challenges too was also that the Department of Corrections came and spoke on this bill. They testified as being neutral around this issue, but they also stated it was not a problem and they did not see a need for it to pass. State agencies often do this where they take a neutral stance on bills because it's a little bit more of the common practice. But we also know that the Department of Corrections is given more credence, especially than people who were formerly incarcerated or directly impacted. The legislators look at them as a state agency and will give them a higher value in their testimony, even though they are not those who are directly impacted. So in planning that, we had to work with our Reframing Justice leaders to ensure that they understood the environment they're walking into, that they felt safe testifying in the space, and that they understood some of the comments that might be given to them by legislators, the Department of Corrections, the media, many other people. It's hard because legislators can ask questions, review arguments, speak at extended lengths, but anyone who is testifying are often limited in how long they can talk, and they're not given the opportunity to counter or respond. This is not over difficult, but can be very scarring towards people who are doing this. And we have to be able to provide an honest expectation of the arena they are entering to navigate the power dynamics and work towards maintaining that trust we've built and moving towards success. This is the key to community-driven design and community ownership. So then with our action, we were able to work with multiple women who had been incarcerated and directly impacted to testify, and 2 of them had longstanding relationships with Grace that felt safe doing this. We had 2 women, Adrienne and Tuesday, who testified about their time, providing clear examples of how women were forced to cope with the lack of resources, being humiliated by prison guards, and unable to get medical attention. We also then worked with them to have interviews with the media and place them as experts in this field. They wrote an op-ed that was published in the Huffington Post, and we were able to continue to connect them with other resources. The result of this was that after 3 hours of testimony on this one bill, we were able to get it passed by a vote of 5-4. But it's important to emphasize when we talk about policy success, it doesn't necessarily mean that a bill makes it all the way to the finish line. This bill actually ended up being killed in the next process because the Appropriations Committee, which would be the next process, refused to hear it. However, because of the testimony, ongoing media coverage, and public outrage this pressured the Department of Corrections to make the internal policy change and increase the access of period products to 36 per month. So that tripled the amount that women were able to get. Success is measured in many ways. The legal policy change is one, such as passing a bill, but the internal policy change is another. And policy work is slow, but cultivating relationships is so important because we are moving towards that narrative shift over time. And while we can't necessarily pass a bill every single time, it is always looking towards that North Star.
I think that the questions that we've drafted really are perhaps private reflection questions to consider your work and what's moving for you right now. We've pulled together some resources here that offer opportunities to explore and deepen your knowledge in a few co-designed research projects from our work together at AFSC. And we're happy to share our slides if you email us. But thank you for joining us, and we'll leave you with this final thought from Adrienne Marie Brown that we felt summarizes the relationship building well for the sake of sustainability and just action. She writes, "Move at the speed of trust." So if you would like a copy, again, email us. Our addresses are there on the screen.